Hello there, everyone. Good morning, good evening, good afternoon, depending from where you are connecting with us. Welcome to our pharmacy academic pharmacy section in FIP. Today's webinar on the impact of pharmacy education on global healthcare system. So first, I will introduce myself. So I'm Hanan Kibaili, Doctor of Pharmacy from Algeria and a member in FIP Pharmacy Academic Pharmacy section. And currently I'm the president of the Algerian Early Career Pharmacist Group. So first, I would like also to welcome our panelists for today. So today's webinar will be focus on how to develop innovative pharmacy education curricula to better respond to global public health needs. And this webinar will also discuss the importance of covering all pharmacy fields and specialties in the pharmacy program and how to integrate digital health in the global pharmacy education. So we will have in this webinar 4 presentations. So the first one will be the benefit and importance of international accreditation in pharmacy education, Jordan case. The second presentation will be about the highlighting innovative pharmacy education curricula. The third presentation will be about providing effective strategies for comprehensive pharmacy education and training. Last but not least, we will have a presentation about examining global tools and approaches to integrate e-learning and digital health to enhance the quality of pharmacy education and competencies of health. And at the end of the webinar, we will have a Q&A session where you can ask your questions. But during all the webinar, you can ask your questions using the Q&A box chat. So I will share with you a couple of announcements. So this webinar is being recorded and live streamed via YouTube. Also, the recording will be available on FIP website. And as I mentioned before, you may ask your question using the question box provided. And we hope to receive your feedback on this address mail webinars. Okay, so now let's start with the first session, the benefits of and importance of international accreditation in pharmacy education, the Jordan case. So I will give the floor to our first speaker, Professor Abir El-Ghanani. Professor, the floor is yours.
Thank you, Dr. Hanani. You want to open the slides, please? Thank you, everybody. Nice to be with you today, talking about the benefits and importance of international accreditation in pharmacy education and taking Jordan as a case. For those who don't know me, I'm a professor of pharmaceutics and biopharmaceutics at Sullivan University College of Pharmacy and Health Sciences. Also, I'm the Associate Dean of Research at the university. You can read about me. So Dr. Hanani, can we just move to the next slide, please? Thank you. So as everybody knows, the pharmacy profession has been really changing, evolving, working more toward patient-centered, more responsibilities in public health. The American Public Health Association back in 1980 recognized pharmacy profession as a major responsibilities for health, public health, as well as the FIP and the World Health Organization back in 2011 emphasized or re-emphasized the importance of the role of pharmacists through their good pharmacy practice guidelines. Now, you can see that we do have a lot of curricular innovations and transformation efforts in order to keep up with these changes and evolving in our pharmacy profession. And you can see there are a lot of things has been moving forward toward the positive impact onto the education as well as the practice of the profession. I'll talk today more about the Arab countries. You can see that FIP reported 126 pharmacy schools in the Arab countries. And I mentioned that because I'll be talking about Jordan as a case to see the importance and the influence of the international accreditation on the pharmacy programs that applied and received the international ACP international accreditation. Next, please. Next slide, please. Thank you. So as you can tell, the pharmacy profession and education has been globally evolving, as I mentioned, more toward patient-centered, as well as interprofessional clinical practice. You can see that a lot of initiation of continuous revisions and standardization of the process, evolving and changing in the pharmacy curricula throughout the world, mandating a delivery of a high-quality education for students, quality assurance resulting from successful international accreditation definitely would be able to enhance colleges of pharmacy strategies, strength toward implementing competencies, labor force developments, as well as economic sustainability. Next. So, what's the purpose of international accreditation and why people would go and try to seek it? Definitely, it will provide a basis for quality assurance. And we put 3 lines under quality assurance because international accreditation will usually position itself more toward quality assurance as well as quality improvement. The purpose of international accreditation also provide a professional judgment of the quality of the profession degree program, so people will know what strengths they have to focus on and what weaknesses they might have that they need to develop and work on too. It also encourage and facilitate continued improvements of accurate programs. Everybody looks for being on the top, and continuous improvement is something that we all work on and keep working on. Next, please. So usually, with international accreditation, the agencies or the firms work with each program within its own country to ensure that they are within the frame of their standards, to assure that we have conformity, to generate expectations of the pharmacy profession, education, and practice needs within their country needs. So nobody is trying to, to impact or just, copy and paste certain standards and just go with it. It's all within the country standards to make sure that the education and practice are fulfilling the regional needs. Of course, it would facilitate the identification of schools of pharmacy that have explicitly undertaken activities directed at improving the quality of their profession programs and carrying them out successfully, to ensure that working with them along the way until they are really successfully implementing and adding to their programs from educational and practice as well. Next, please. If we take Jordan as a case, you can see that among the Arab world, really Jordan has been at the top priority side, basically applying to international accreditation. And you can see here, I added a list of the schools of pharmacy that applied and received the ACPE international accreditation. In fact, some of them, they just received their letters from Dr. Mike Rouse, I think maybe just a few days ago. So basically, we have Zaytuna University of Jordan. They got it for their BS program, Applied Science Private University, also for their PS program. The Jordan University of Science and Technology, as well as the Jordan University, they got it for, or the University of Jordan, they got it for both for their BS as well as PharmD programs. University of Petra, Middle East University, Al Ahliya Amman University, Mu'ta University, and Yarmouk University, they got it also for their BS pharmacy degree programs. So as you can see, we do have a lot of those schools already applied and received it. Some schools are still in the letter of intent or at the stage of submitting their application. This is for the case of Jordan, but definitely that applies to a lot of schools of pharmacy worldwide. Next, please. So what's the benefits? Why people want to apply for international accreditation, and how this impact, the pharmacy education and practice? And focusing on Jordan, you can see that in general, basically, that would encourage stakeholders. And when we talk about stakeholders, we talk about people who are part of the, will have an interest in the academic programs as well as on the practice. So they will be also involved in the feedback to school strategic plans. They will be part of it. In addition to the staff, students, you're going to have the preceptors, practitioners, regulators, people in the pharmacy education and practice. All those will be just, part of the stakeholders that will be part of making decisions and help in feedbacks to plan and draft the strategic plans for the school. Develop and implement competency-based pharmacy education. That would definitely prepare pharmacists better to their roles and be able to fit them better in the team among the healthcare system. Next, please. Definitely, that would also develop a culture of assessment, measuring outcomes. And this is important because you need to know how you're doing. You want to have a mirror image of reflecting on where you are from achieving your mission-related goals, plan for continuous quality improvements. And that's not going to happen unless you have that wonderful, nice cycle of assessment to give you some sort of measuring of those outcomes and reflecting on where you are with achieving your goals and what you need to do next. It also helps in self-identification of areas needing improvements, commitment to resolutions of areas of non-compliance in a timely fashion, because you still have to report to those international accreditation firms and ensure that you are within the standards. Of course, schools of pharmacy and universities offering accredited degree programs expected to basically be socially accountable by modifying and updating their requirements, reflect contemporary rationale, on their national as basically social needs, advances in knowledge, technology, and practice, and keep up with the change and the improvements in the profession. Next, please. So international accreditation programs has driven changes in education. And talking about Jordan, I'm really honored and love what I see in what's going on in the region, especially in Jordan, with the pharmacy programs that have been applying and receiving the international accreditation. You can see at the level of the country, as well as the programs, Jordan had nationally mandated graduate competencies. It's more like CAPE-like the one we have in US, and that's been implemented and mandated all over the country. They do also have a nationally mandated experiential education in the curriculum. So it's a must. It's been implemented, structured, and more driven with quality assurance. They do have also now better systems of assessments like OSCEs, more to provide better assurance of receiving understanding of skills, be able to measure those practices and skills and achieve the competencies. They also nationally mandated continuous professional education through the channels with the Jordan Pharmacy Association and other institutes. So you can see that there is a lot of improvements, impacts since the last decade in improving the pharmacy education, and that been driven by applying and receiving international accreditation that would add up to the regional as well as the national and international pharmacy education and practice standards and competencies. Next, please. So in conclusion, pharmacy education should be directed toward addressing needs and making use of the valuable opportunities. And you can see I always focus about local needs. We are big in our profession and practices, but we need to make sure that we are also within the needs of the region or the local needs. So that's where we start. We work locally, but we think globally. So definitely addressing the local needs, making use of the valuable or available opportunities, whether it's in the industrial pharmacy, hospital, community, public health, etc., fulfill all those needs. International accreditation bodies would support and could support the profession by creating a quality assurance management system to help a school reaching their goals and ensure quality. And by this, well, thank you so much. I'll move back to Dr. Hanani.
Thank you so much, Thank you so much, Professor, for this brilliant presentation. So now we will go to the next presentation. And before, I would like to remind you once again that you can start asking questions using the Q&A tool. And now I will give the floor to our next speaker, Dr. Anisha Sandhu. Anisha, the floor is yours.
Hi, thank you very much, Hanane. Good evening from Malaysia. My name is Anisha, and I lecture for Monash University, Malaysia. I lecture in pharmacy. I'm part of the International Pharmaceutical Federation. I hold several roles here, and I'm also part of the Malaysian Association of Education for Medical and Health Sciences, part of the Strategic Task Force there as well. So next slide, please. So today I was invited to speak about innovations in the pharmacy curricula. And I guess, as we all know, the past 3 to 4 years have spurred, rapid change in education across disciplines globally due to the pandemic. And education delivery is no longer confined to traditional on-campus and physical in-person learning experiences, because institutions more and more have embraced not only the transition to online mediums during the pandemic, but they've also embrace the best of both worlds through hybrid teaching post-pandemic. So studies have shown that students as well are equally accepting of either mode based on the type of educational experience. And so this allows for greater flexibility in innovating our curriculums and programs to find ways that suit different teaching activities. So we also now have far more advanced digital technologies as well that allows for a wider range of experiences to be delivered online. And for example, we can host interprofessional education workshops virtually, or we can even have certain lab-based activities tailored to be delivered in a more resource-efficient manner online. We're also able to leverage designing our curriculums to deliver maximum impact for optimal student learning outcomes, because we now have greater evidence available on the impacts, both positive and negative, for online education. Next slide, please. So in this presentation, I'll be touching briefly on a few themes in pharmacy education innovation. And where possible, I'll try to provide some examples of the implementation of these innovations in Monash Pharmacy curriculum. I'll get you to move to the next slide, Hanane. So the first theme, which I feel very strongly about, and it's an area of research interest for me, is student well-being and wellness education. There's no denying that the effects of the pandemic highlighted the inadequacy of mental health support for students, especially those that are enrolled in demanding degree programs, such as the field of healthcare. And the second theme, which I'll touch on, is an area of interest for me as well, and that is interprofessional education. So once upon a time, it was a novel idea to bring students from different disciplines to learn together from each other and about each other. But over the past few years, interprofessional education, or IPE, as I'll refer to it, has become a key component of most healthcare curriculums. So we're now able to also conduct these sessions virtually. And that, again, helps us maximize on resource efficiency. It also allows us to break physical barriers to investigate piloting even potentially into university or international IPE programs. The third theme that I'll talk about is laboratory-based teaching. These were activities that were once only confined to in-person teaching, but the pandemic's pushed the creativity of academics to find ways to teach certain aspects of laboratory activities online. And then we'll talk about computer-based simulation. So that's the fourth theme. This was introduced prior to the pandemic, but it was also, it has become during the pandemic a great way for students to still feel immersed in pharmacy environments. And finally, one of the interesting themes that has also emerged in education over the past few years is gamification. And this has pushed many academics, caused them to push the boundaries of their creativity to include aspects of gamification in their teaching. I'll get you to move to the next slide, please, Hanane. So in this next slide, let's talk about student well-being. So it's no secret that healthcare degrees and curriculums are demanding, and they can challenge the personal wellness of students who have been found to report that they tend to feel stress, exhaustion, anxiety, depression, even face sleep difficulties. And there are many factors associated with healthcare education that can impact the personal well-being of healthcare students, among which is academic pressure, poor support systems, mental and physical workload, and sleep deprivation. So in order to address this actually, and spurred by the effects of the pandemic particularly, schools worldwide have taken steps to incorporate new or even innovate and consolidate existing wellness curriculums, initiatives, or exercises within their degree programs. And several institutions have created dedicated curriculums to wellness, while others have chosen to redesign their programs to include learning and professional development wellness as core competencies. Some have also considered less rigid and quantitative grade evaluation systems or looked to improve cross-disciplinary education programs to enhance student learning experiences. So at Monash Pharmacy, we've been working on building a resilience curriculum that is delivered across all year levels to support students in cultivating resilience and to support them in having better coping strategies. And we do this through dedicated skills coaches. A recent project of mine that was also funded by FIP's ACPS Society was to look into piloting and evaluating, as well as re-implementing an improved resilience module for final year pharmacy students. We're currently completing analysis on that project, but so far results are looking really good. Another example also, which I covered in a recent FIP webinar, is the Monash PIES program. So this began as an online academic-led program during the pandemic, and that the main focus for it was to alleviate social isolation and stress faced by international students. So the aims of that program were to improve student engagement by prioritizing communication, well-being, and support. The program has now flourished to improve student engagement, not only online, but also in person, within institutions, and even internationally. We've even had events where we've involved students from countries like Sweden, Malaysia, and Australia together. I'll request that you move to the next slide, Hanani. So one of the exciting aspects of pharmacy curriculum innovation was actually introducing virtual collaborative online learning. So we did this through a variety of ways. There were institutions looked into started to look into university learning experiences even. So at Monash Pharmacy, we work together, especially in Monash, Malaysia. I'm one of the coordinators for the IPE portfolio. So we looked into actually implementing a self-directed online IPE module for students, where we brought together around 200 to 300 pharmacy and medical students together in a semester to learn about cardiovascular and acute kidney problems in a simulated case scenario. And so students work together over a 2-hour workshop to solve a case scenario as stated, and they had to work together to actually create all kinds of patient education resources. They had to answer a lot of different case questions to test their knowledge about not only the clinical topic that they were taught, but also about each other, the roles and responsibilities of different healthcare professions. And what we found was that the results that we got was actually overwhelmingly positive, because students not only found IPE to be useful, but they actually found conducting IPE online to be one of a very useful way for them to actually have this sort of experience. They thought that it tries to try and see. Sorry, it says that my internet connection is unstable. Hopefully you can hear me. So another thing that we tried to do as well is to try and see if we can create collaborative online learning experiences, not just between different schools in the same university, into university as well. So that's actually another project that we're working on currently at Monash Pharmacy, where together with my collaborators in Monash, Australia, we'll be looking to collaborate together with the National University of Singapore to see if we can actually create a series of modules for our final year pharmacy students to come together to learn about situations like leadership, for example, or cultural competency. So in the interest of time, I'll quickly move on to the other. Okay. I'll switch off my video because I just received a comment that my voice is breaking. So hopefully that will help. The next theme that I wanted to cover, I'll get you to go to the next slide, Hanane, is outcomes of the pandemic was the use of the virtual medium to deliver laboratory teaching. So virtual lab platforms such as Labster and PraxiLab allowed academics to create relevant online lab exercises related to syllabus and transform a regular physical lab session to exciting gamified modules that would require multiple steps for students to resolve various research problems. So students could provide instant feedback when encountering problems, while built-in actually strengthened their problem-solving skills. Post-pandemic, there's now this increased flexibility to offer virtual and hands-on training for lab-based pharmacy education activities. So you can actually decide which mode suits what style of activity better. So students are also exposed to more educational for immersive simulated lab experiences where they can not only learn content without being restricted to the boundary of a physical space, but we can also simulate experiences without requiring intensive resource investment. So this is actually a great way for a great alternative to actually offer lab activities. It also allows for us to deal with the issues that students tend to face about inconsistencies in teaching delivery methods as well. On the subject of simulation, and I'll get you to move to the next slide, Hanane. Another theme of innovation in education is the use of computer-based simulation in pharmacy curriculum. So during the pandemic, there was an increased pressure on clinical placement availability. And the use of computer-based simulations to mimic pharmacy practice environments actually gained a lot of traction. So computer-based simulations are an innovative, flexible, safe, and cost-efficient approach to train pharmacy students in different healthcare settings. So the screenshot you see here is the MyDispense online pharmacy simulator. So that's a product developed by Monash University's Faculty of Pharmacy and Pharmaceutical Sciences in the community pharmacy setting. There's also another well-used simulation software known as the Virtual Interactive Case System, and that offers simulations in the hospital setting, though it's not created by Monash. It's also free of charge. So these softwares can be used to provide practicing, medication counseling, while also doubling up as another mode of assessment for student skills. So students can receive instant or delayed feedback depending on the type of settings that are chosen. Though I guess a limitation and a design focus that could be recommended for these softwares to continue innovating on is to offer more healthcare settings within a specified product and to consider interdisciplinary case scenarios as well. Now I'll cover my final theme in my last slide. So I'll get you to move on to the last slide, Hanane. Great. So finally, let's talk about gamification. So literature has shown countless of benefits using game-based learning across a variety of ages and disciplines, with benefits such as problem solving, strategic and critical thinking, increased engagement, memory capacity. So as an academic, incorporating games to teach and train our pandemic was the use of educational escape rooms, which is not only a great way to complete a novel challenge, but it's a great tool for team building as well. At Monash Malaysia, we've actually used educational escape rooms as a way to teach clinical pharmacy in a more fun manner. We also are now, it's very commonplace to use quiz games, things like Kahoot, Poll Everywhere, to make lessons and web-based lectures more interactive, as well as a way to gauge audience retention or percent of knowledge taught or acquired. Next is game-based simulations, which has also gained increased interest. So in my research for this talk, I actually came across something known as the Australian Pharmacy Game. So it's a game that involves final year student teams to competitively manage simulated pharmacies for 3 weeks towards the end of their degree program. So it usually involves about 6 to 8 student teams, about 5 to 8 students per team, and they complete continuous pharmacy-related tasks. And they use this with simulated patients, and it's aimed to provide this authentic learning experience where students assume the role of an autonomous pharmacist making decisions, contacting different healthcare professionals, providing patient consultations, helping them to develop their professional and collaborative skills. I mean, how exciting is that? I would have loved an educational experience like that as a student. Finally, we've got many academics who have found ways to test student knowledge in fun ways like using crosswords, search a word, and many more options as well. So really, there's been a lot of innovations in pharmacy education, especially over the past few years. It's a very exciting space to work in, and I'm really looking forward to more innovations and to collaborating with more academics to create more exciting innovations in pharmacy education. So thank you very much. Hanani, I think my next slide are my references, so I'll pass it back to you. Thank you.
Thank you so much, Anisha, for this excellent presentation. And through that, innovative education will positively impact pharmacy education worldwide. So now I will also once again remind you that you can start asking your questions using the Q&R tool. And now we will move to our next presentation. So it will be about providing effective strategies for comprehensive pharmacy education and training with our next speaker, Professor Martin Henman. So Professor, the floor is yours.
Thank you very much, Hanani. So hello, everybody. My name is Martin Henman, and I'm going to talk to you today about comprehensive pharmacy education and training. I'm going to concentrate mostly on talking about the training, and I am a member of staff in Trinity College, Dublin in Ireland, as well as a member of the executive committee of the academic pharmacy section. Can I have the next slide, please? So this gives you an outline of what I'm going to talk about today and some of the headings that I'm going to use. One of the key things for us to remember is that education and training are the basis really for most of our activities as individuals and as societies. In addition to that, of course, education and training is particularly important for the development, the delivery, and sustaining the healthcare system. And so pharmacists are an essential part of that. So therefore, our education and training needs to be fit for purpose. We go on to the next slide, please. Education is about development of us as individuals, and also the development of the profession and the development of the health services. In order to make changes to large, unwieldy programs of education and training, what we need, therefore, is a system for doing that. So on this slide, we have the two things, the Program Development Committee and the external influences. The Program Development Committee is absolutely crucial to this. It needs to be a determined management team with change management skills, because, as I say, curricula and institutions find change difficult to grasp. Equally, those of us who are professionals find change sometimes difficult to grasp, and in particular to implement. So any program development committee needs to have not only the authority, but also the capability and capacity to do this. And they need to be able to do that because, of course, they're going to increasingly have to cut across traditional academic disciplines, change hierarchies to some extent, and very much within university-type institutions and hospital-type institutions, one is dealing with established hierarchies and of power and control. Can you just flick on, please, Hanani? Thank you. So up at the top right there, you can see that elsewhere in FIP, in order to help bodies like program development committees, there is a leadership program through the Global Academic Leadership Fellows program. And these are very useful for people who are attempting to develop in this way. Any development committee needs a very clear and equitable management structure and transparent processes in order to be able to deliver the types of compromises that are required to bring about change. And in academic pharmacy section, we've developed a global competency framework for education, educators and trainers. And part of that is to help with the capability and capacity of schools of pharmacy and of institutions like hospitals and professional associations around the world to deliver not only undergraduate education for the qualification, but also practice education and work-based education. You then also have to think about the external influences, and any program committee would have to do that. And what's just disappeared from the screen there is FIP's graphic, which relates to needs-based education. The needs-based education is, as one of our earlier speakers, our first speaker today, said, both locally and nationally and globally. So we're looking at all of those things. Also crucial to that is, in my university, it has a particular approach to education, and it tries to communicate that to people who are either thinking of working with us or coming to join us as students by setting out the attributes that it expects all of its graduates will achieve. And you can see them there on the slide. To think independently, to communicate effectively, to develop continuously, and to act responsibly. Now, for some of my other colleagues in other areas, other faculties within the university, the introduction of graduate attributes was a real revolution in their lives. Whereas for us, because we are working within healthcare, it was really very straightforward. We were already moving down this path, and you'll see why on the next slide. Before we can go back, sorry, Hanane, if we can just stay there for a second. The first speaker talked a lot about international accreditation, and that's very powerful and an effective tool. In Ireland and in a number of other countries, we have very much our national accreditation process. Our national accreditation process is run by our pharmacy regulator. They regulate the profession, they regulate its performance, and they do so on behalf of the Irish government, and in particular on behalf of the Ministry for Health. So they not only regulate education, they align it with the needs as they see it of the profession at entry level, and they also align it to other external influences, one of which is very much patient safety. So throughout our health services, patient safety is a major priority. And on the right-hand side of the slide there, you can see one of FIP's documents in relation to the WHO goals for medication without harm. The next slide, please, Hanane. Thank you. Essential beginnings, then. The first, I often refer to it as reverse engineering. Not everybody finds that a helpful title, but it's thinking about what it is that you want to achieve. And it's not what you want to achieve in the sense of what knowledge do you want this person to have. It's what they need to be able to do, what your outcome is going to be. And if we were in the pharmaceutical industry, we might call it quality by design. So we're starting from there to think about what we're going to put into the education and how we're going to develop it. One of the reasons for that is because it's very easy to start off thinking simply about content. Do we have enough pharmacologists, enough pharmacognosists, enough pharmaceuticists, pharmaceutical technologists to deliver a course? But actually, that's not our first problem. Our first problem is, what do we want to achieve in this course? So what should our pharmacists be able to do? A pharmacist, should they be capable of entering any field of practice, which is the case in my country, or in some other countries that I know, a pharmacist who is capable of entering patient-facing practice when they graduate, but also has some knowledge of other fields of practice. So it varies from country to country. This is why the education needs to be locally and nationally relevant. Can you just flick on, a graphic will come up, please, Hanane? Thank you. So the first of these is, you will remember, some of you, the WHO put forward an idea of a 7-star pharmacist, a caregiver, a decision maker, a communicator, a manager, a teacher, a lifelong learner, and crucially, a leader. If you put the next graphic up, please, Hanane. Thank you. These things always develop. So other people came back almost instantaneously and said, particularly academics, of course, and said 7 stars are not enough. There should be an 8th star. They have to be a researcher. and because all academics do research. And then underneath that, in this fund, which is a 9-star pharmacist, they're an entrepreneur. So this is very much this idea of aligning to what it is that you want to achieve at the end. Now, the professional qualification. We have, in my country, we have had a bachelor's and we've now moved to a master's as our qualification as entry into the register of pharmacists. In other countries around the world, it is a PharmD. And that allies not only to what the nature of the qualification is, but also to point to there. What should this pharmacist be able to do? So when pharmacists leave their School of Pharmacy in Ireland, they are deemed to be ready to register and therefore to enter practice straight away. That's crucial. Can you put the next graphic up, please, Hanani? Thank you. FIP, once again, through the Nanjing statements, has set out many of these issues and many points related to these in the Nanjing statements, which are very useful and once again provide a basis for us. Some of the points that they touch upon are the curriculum, are the idea of experiential placements. Some of these will be required. There may also be the possibility of students undertaking informal experiential placements, perhaps during their vacation, and being able to record their work there, what they got on with, and so on, and put that, for example, into a portfolio that they keep as they go through the course. And then, and crucially, there are, of course, relationships between staff and management, between the staff themselves, and crucially, with the students. Can we have the next graphic on the slide? That's it, thank you. And once again, then, through FIP, we have a competency framework which sets out many of these things under the 4 headings of pharmaceutical care, pharmaceutical public health, organization and management, and professional and personal development. Can we go on to the next slide, please? So, another essential beginning then. Who is a learner and who is a teacher? Learners should be autonomous thinkers. They shouldn't be passive recipients of information, as the slide says. The teacher is a facilitator who is helping the student to realize their potential, to understand how they learn and to maximize their learning opportunities and make the most of the course which is offered to them. This is quite different to an old idea that the person is an authority who gives lectures, provides the standardized views, usually their own, and then walks off and is unaccountable for it. This is not the case. Learners and teachers are interacting, as we heard in the previous speaker's session, in order to maintain the development of the course and also for their own mental stimulation. The next slide, please. Integration is increasingly an overarching requirement for all healthcare courses. The reason for this is, of course, that there is a massive increase in the amount that we know. In a sense, we know too much to know much, as the saying goes. Crucially, once again, we have to think about what it is we want pharmacists to be able to do. We want them to be able to make decisions about patient care by applying all of the relevant pharmaceutical and medical knowledge to the issue. So this is very much about learning in this way. It's very much about the context in which the learning is occurring and in which the knowledge, the skills, and the performance is going to be enacted. Health sciences education incorporates increasing levels of integration, both of disciplines and of experiential learning. And this therefore means that there is both horizontal and vertical integration. The ladder on the right, which comes from a man called Harding, sets out an integration ladder from very low level of integration down at the bottom there, harmonization and temporal coordination, and going up right the way up where we would hope to be, somewhere around multidisciplinary. And that this occurs across a year or across a segment of the course and vertically across the years or the different semesters or different core elements of the course. It also means, of course, that disciplines are likely to provide modules, but not necessarily modules which are just provided by them, but through collaboration with colleagues in other disciplines. And learning and assessment then is aligned to the nature and the purpose of what we are trying to do and each of these learning outcomes. The next slide, please, Hanani. Thank you. So integration, and we're looking here at curriculum types. Linear and sequential is the traditional one, starting with foundational knowledge and working on through ultimately to ending up usually at practice. Linear and integrated tries to bring in different elements, particularly practice and particularly experiential placements earlier on, and put those in and help that development go on. And then spiral and integrated, and you can see a graphic for that on the right-hand side. If you think about any form of learning, it usually starts out with some relatively simple, perhaps one or two concepts being used at a time, and applying those to a comparatively simplified and therefore not necessarily entirely realistic scenario. And as the learner goes on and develops their understanding of more and more concepts, they are able to apply more concepts and apply them to more complex situations as they progress. So disciplines and topics in spiral curricula are revisited. So we may start out by looking at some simple gastrointestinal problems, their treatments, their occurrence, and so on, and the delivery of medicines to the GI tract in the early years, and then in the later years, look at far more complicated situations, both in terms of the treatment, in terms of the disease, and in terms of the pharmaceutical forms that are used for them. And the delightful man at the bottom there, Brunner, is one of the people who put this forward. If we could have the next graphic, please, Hanani. Thank you. And in a FIP document, we're going to see it in a little while, this spiral curriculum is shown in that graphic with the 4 sets of competencies grouped at the top there, the 4 domains of competencies of the pharmacist. On to the next slide, please. Thank you. Experiential learning is a crucial part of all healthcare education. Our intent is to provide somebody who can enter practice. So we're really looking at the novice there, but we are setting them off on a pathway to be able to go on to become more advanced as they gain experience. Within the course that we're looking at, we have to say where, when, how, and what sort of experiential learning does the person need? Is it going to be in community, hospital, or elsewhere? Our curriculum modules in the academic course must align with all of this. The people who look after our students, both from the university and from the practice sites, must understand the processes of supervision and also how to use reflection and what reflection is. And if you look at the graphic on the right-hand side there at the bottom, you can see learning for practice, learning in practices, and learning by practicing. This is what we hope we'll achieve, and our teaching, learning, and assessment has to be focused upon this. I'm not going to talk a great deal about assessment, but the different types of assessment, such as OSCEs and so on, have already been mentioned, and in the previous speakers' session and in the next one, you've heard some of the other type ways in which assessment can be managed. The crucial thing in experiential learning is that this is being done in the workplace, so it has to be fit to work there. And we're also going to look at progression, knowledge, skills, attitudes, and values. Students cannot go from one experiential placement to another unless they have achieved what they needed to do, what they're required to do in the one in which they're in at the moment. Because otherwise we are setting them up for failing in the future. So the next slide then, please, Hanani. Thank you. Educational strategy, then, most people simply refer to it as a teaching, learning, and assessment strategy. I prefer to think of it as an educational one, incorporating teaching, learning, and assessment, the supervision, the liaison between the university or between the educators on the one hand and the workplace on the other, and also the support strategy. And you heard some of that in the previous speaker's session, including peer-to-peer students supporting other students, particularly older students supporting younger students. And we then have progression and reassessment. Students need to be able to progress at a defined rate through the course in order to get to the end point. If they fail something on the way through, there has to be a comprehensive process for reassessment. In my country, at the moment, our students have to complete their degree course within a particular period of time. Otherwise, they are not going to be up to date with their competencies when they come to practice. In terms of the teaching strategy, we have the demonstration for practice, we have the simulation of practice. All of those things can be done within the academic context in order to prepare people to go to practice. So if we can have the next piece, please, thank you. Then they will be able to observe practice, undergo supervised practice, and ultimately our aim is that they should be able to independently practice under supervision. On the next slide, please. Competency frameworks, outcomes, and learning outcomes. I think this is fairly straightforward. Everybody probably listening to this is familiar with this. Competency frameworks are a tool that we can use to help us with our review, help us with our mapping, help us setting out our scope of learning, and providing a way essentially of establishing minimum levels of attainment and a structure in which feedback and discussion, particularly about progression and about each of the units within the course, can be defined. And up at the top right, the graphic once again refers to the Global Competency Framework, supporting the development of foundation early career pharmacists. You can click on the next graphic for me. Because education leads to development, helping someone to develop intellectually and helping them to continue to develop professionally. The next slide then, please. Changing education is a complex process. So it's really about evolution, not revolution. It's about continuity rather than disruption. And disruption is a very popular term these days. Interprofessional education, which you've heard a bit about already, ethics and professionalism, research, and then the emerging aspects of practice and of teaching and assessment. All of these things need to be brought into the whatever course is there. So therefore, our program development committee must morph into a program management committee to be able to provide indicators so that the course can be assessed, so that what is happening with it and how it is functioning can be assessed. We also need a stakeholder advisory group to enable us to keep in touch with people. On this slide, you can see a number of different graphics, and in particular, the competency-based education in pharmacy and pharmaceutical sciences, produced by colleagues in the academic pharmacy section, is a crucial one. On the next slide then, please. So from that handbook, you can see here essentially a summary of many of the things that I have said, and it also reflects one of my early slides too. The goal of learning is not is learning rather than teaching, and that in particular, when we look down through all of these things here, you can see the points that I have been making with you. Now, on to my final slide then, please. We need education and training in order to help us manage the challenges that we face. In particular, taking responsibility for judgments about the use of medicines, the care of patients. We usually have to do this with imperfect data, with a limited amount of evidence, not all of which is of good quality, and under a time pressure. So all of the bullet points underneath there, you can see are things that we are trying to help learners to attain in order to be able to go on and practice. We also are trying to help our staff attain these so that they can sustain the practice that they provide at the moment. Without education and training, we cannot sustain our profession. Next slide, please. Thank you very much. Guru Mahakat.
Thank you so much, Professor Martin, for your very valuable presentation. And now we will go to our last but not least presentation for today. But before, once again, I will remind you that if you have questions, you can use the Q&A tool. Our speakers are answering the questions. So our next presentation will be about examining global tools and approaches to integrate e-learning and digital health to enhance the quality of pharmacy education and competencies of health. Dr. Carl Schneider, the floor is yours.
Thank you so much, Dr. Kabali. It's a true privilege to be able to present to so many of you here today. It's wonderful to see so many people from all around the world. So in about 10 minutes or so, I've been asked to explore this topic of global tools and approaches to integrate e-learning and digital health to enhance the quality of pharmacy education and competencies of health, which is quite a large topic. I should mention I'm coming from Sydney, Australia, where I'm an associate professor at Sydney Pharmacy School at the University of Sydney. I also would like to disclose that I'm a treasurer of the academic pharmacy section for FIP and a member of the FIP Technology Forum. Thank you. Next slide. So the first thing I thought I would do is think about using a crystal ball to see what the future of pharmacy will look like. And you are welcome to have a look at this link yourself. And this is a link to an AI engine where you can basically provide pictures from text. So from the future of pharmacy, I got two gentlemen here of an AI created pharmacist. I think we could, with a bit of polish, we could crop that picture and we would be able to give ourselves an AI generated image of a pharmacist in a quite a busy pharmacy with respect to the number of medicines that we'll be providing. Next slide. Oh, too far. So besides the picture, I thought another way to find a way to work out what we should be talking about today is I would capture the zeitgeist and ask ChatGPT. Now, ChatGPT, if you haven't heard of it, you will hear of it. It is a natural language processor model. And it's on the OpenAI platform. It's received about $10 billion estimated of funding from Microsoft. And in the space of 40 days that it's been available, so end of last year, it's has over 10 million daily users, which perhaps is about over 20 million monthly users. This uptake in technology is faster than Facebook, faster than Instagram, faster than Google when it launched. So this is something you'll be hearing about. So what does it do? It is being trained on a large data set on the internet up to about 2021. And it encompasses data from user data, social media data, such as Reddit, Wikipedia. So it doesn't exclusively provide academic data or scientific data. And I asked ChatGPT, what should I talk about for this topic for pharmacy educators? And they provided this response. I should talk about online learning platforms, virtual and augmented reality technology, digital health tools such as telemedicine, electronic health records, social media platforms in e-communities, adaptive learning platforms, mobile learning, gamification, and the last one that isn't on here beyond the screen is learning analytics. So I thought that's pretty close to what some of the speakers have already mentioned, and what I could do is supplement what we've been hearing about from the other three speakers today. Next slide, please. Before we work out how we're going to take our step into the future, important thing is to find out what we are doing with respect to pharmacy education and the incorporation of the digital health agenda. And I would like to point you towards a very important report that was developed and edited by FIP. Some of you may have been involved in the production of this report in 2021, which is developing a digitally enabled pharmaceutical workforce. Next slide, please. In one chapter, they surveyed what digital health tools would be important for pharmacists to know. And these are the tools that we should be providing education for. These involve electronic health records, e-prescribing and e-dispensing, blockchain technology, which is probably the most promising way in which we can provide security for digital data, online pharmacies, wearable technologies, so something like a watch or even a digital a monitor for blood glucose levels, bots, mobile applications, digital medicine, digital therapeutics, remote patient monitoring, telehealth virtual care. These last two obviously became far more important over the last 2 years as a result of the COVID-19 pandemic. Artificial intelligence and big data. Next slide, please. So in 2021, an international survey with respondents from 260 institutions showed that only a minority of us in pharmacy schools across the world are providing some form of education with respect to digital health on any of these topics. So at 43% of the respondents. On the next slide, they go on to provide a graph or a table of what we're providing education for. So in the blue, we see tools that were covered. And when I say covered, this range from any form of education, whether it be a lecture, 1 hour, to through to immersive technology, skill development and assessment. As you can see, if we go back one, mobile applications at 63%, the majority, and electronic health records, a bare majority, and online remote patient counselling. This is in 2021. I suspect this was after the COVID pandemic had hit, but I think that this is going to be developing further in this current situation with ongoing waves of COVID-19 that are continue to manifest. However, I would like to point down to the bottom, consumer medical wearable technologies. I think this is a very important area that we don't cover very well at 19%. And if you look at tools that respondents were interested in teaching, the ones that have yet to provide education, that's at 5%. I think this is a very large area of interest because wearables are going to be providing the majority of health-related data in the coming decades. Traditionally, health data was generated by health care practitioners and the tools that healthcare practitioners used. As pharmacists, we know a lot about medication management and medication management related data through dispensing systems. We've moved towards integration into clinical medical records. However, we need to look further towards wearables. And this is an area that I think is very important. Next slide, please. I'm being mindful that I've only have 10 minutes. Another resource that I'd like to point all of the participants here today at the webinar towards is the Educase Horizon reports. Every year, and they've got an archive of reports that spans back over a decade. They survey educators at university level what they think is the main topics that are going to be coming up and how important they may be. And I looked at the last year's report on Teaching and Learning edition, and they said the main topics were, for them, they thought, were AI for learning analytics, AI for learning tools, hybrid learning spaces. This is the environment by which one can provide education that is dual, as in it will be remote and in person. Some people may have heard of high flex teaching. Mainstreaming hybrid remote learning modes. We've learnt on the job over the last 2 years, and an important thing to do was now transitioning from an emergency setting to a mainstream setting of how we deliver remote learning. You notice that we heard from Anisha talking about interprofessional education to be taught remotely in her institutions or cross institutions. Another important area is micro-credentials. This is the idea of degrees no longer being essential for education. Martin mentioned that we're somewhat protected through the accreditation process. A degree needs to be accredited to become eligible for registration as a pharmacist. However, we may see emerging micro-credentials that will supplement the entry-level pharmacy education, and this will align with continuing professional development, for instance, that we deliver as educational institutions. Finally, these things won't happen without educators and educators being technologically adept. So professional development for hybrid remote teaching is required. Next slide, please. I will briefly talk about AI for learning analytics and learning tools. Next slide, please. So what you see here is an image from a paper of a visual dashboard to enhance pharmacy teaching that's been developed at University of Sydney. And this is a dashboard, thank you, dashboard for dispensing, in teaching integrated dispensing. And from this, we are able to real-time capture the performance of students across over 200-300 students, multiple classes, and this facilitates the consistency of delivery and also identifies areas in which we need to provide additional education. Next slide, please. A more sophisticated learning analytic model is the idea of integrating human activity with technology. And this is also from Australia, Monash and UTS. You'll see a simulated ward where you'll see students, in this case nurses, will be having monitors, and they would be able to look at how they interact with technology, how they interact with patients and their colleagues. And this can be incorporated. And what I love about this is the idea is that it's incorporated through expert-driven storytelling. The idea is that they can provide you with a story about what the performance of what occurred. Next slide, please. Anisha already mentioned My Dispense. Another AI learning tool is Accreditation, which is a learning tool for reflection. So you can see down there, reflective pharmacy, the idea that's been developed to allow pharmacy students to gain advice on how they can structure reflective assignments or reflective activities. Next slide, please. If we go back to ChatGPT, I've seen briefly some talk in the chat about how this is potentially disruptive. Sorry, Martin, I think it might be. There's on the MetaArchive server for preprints, they use ChatGPT to test it against the US MLE, which, as some of you may know, is a series of exams for registration as a medical practitioner in the United States. And this actually performed reasonably well, not to a pass level, but at about 50%. Similarly, they've used ChatGPT and taken an example pharmacy intern assessment or exam in Australia, and it scored overall 57% on that test, which is still shy or below a pass mark, but as you can see, it's getting very close. Next slide, please. So I presented this slide in 2021 at a previous webinar, digitalization. And when I say digitalization, this is the idea of not just making data digital or digitizing. This is actually transforming the process to become digital. This can be disruptive, and it's considered the fourth industrial revolution. I think ChatGPT will. Next slide, please. So I'd like to finish by saying disruption is happening now. As I said, ChatGPT is taking off, but there will be others. There's also other learning models such as PubMed GPT. I think Microsoft is discussing incorporation of the technology of ChatGPT into Microsoft Office. So it's going to be very difficult to clamp down on people using it. We're going to have to redesign how we educate and assess with this disruptive technology. We need to partner with technology. We can't tell people not to use it because we need to educate. Our graduates need to be using this technology as graduates as they enter the workforce. Finally, I'd like to finish by saying we need to remember that we are human. It's important not just that we're teaching how to interact with technology, we need to remember what we bring to the equation. And that's our affective skills, our communication skills, our empathy. And these are the challenges that Martin mentioned at the end of his talk. I agree, they're the challenges as well. Thank you for your time.
Thank you so much, Professor Carl, for your excellent presentation. So now we will move to our Q&A session. So we have already 8 questions out of 10 already answered by our speakers. So now we will start with the questions that we already have. And I invite you all to type your questions in the Q&A tool. So our speakers will start answering your questions directly. So here we have a question. I think it's for Professor Martin. So the question is, what can be done to implement what the focal point of this design in resource-limited pharmaceutical setups in developing countries so that a gap between the first word and third word pharmacist is bridged? Professor Martin, the floor is yours.
Thank you very much, and thank you for this very important question. I think, as I said in one of my last slides, this is about evolution rather than revolution. And where resources are constrained, as they are in many countries, it therefore means that we need to look at those things which we can achieve at the time, which most accord with the priorities that we are setting. So once again, I think you begin essentially at the end, and you look and say, what would I like to achieve? Where would we like to be when we have made these changes? And then to prioritize what can be done and to direct some resources towards those. I don't think, and of course, in directing resources, we're then going to sit and look at the resources that we need to put into it, the resources that we have available, as well as how much those resources are going to cost us if we try to deploy new ones. So I think it's very much, as I say, about beginning at the end, drawing up an agreed procedure in order to be able to direct the limited resources into the most important areas, which will begin to move the process forward. I think as that happens, we can also engage with other people in not only telling them what we're doing, but also in, perhaps with any luck, enlisting them in helping us to do it. Because it may be the contribution of people's time and effort and support for us that, in a sense, adds to our capability. We are not all of us in this alone. We are in it with others as part of a community. I hope that helps.
Thank you so much, Professor, for your answer. Now, we have a question for Anisha, for Dr. Anisha. So, Anisha, the question is, can you please elaborate on methods for evaluation and assessment of interprofessional education? Because I think that you mentioned interprofessional education in your presentation. Anisha, the floor is yours.
Thanks, Hanani. In terms of evaluating and assessing interprofessional education, personally for me, how I've been going about it is seeking a lot of feedback from students and also looking into forming kind of panels of experts, as I would like to say, to see how they feel the way the content is being taught. Is it being taught in an effective manner? Do we feel that in terms of the learning outcomes, are the students actually achieving those outcomes? Are we actually assessing them appropriately? Also the fact that, you know, we're bringing together students from different disciplines. And so in terms of interprofessional education, are we trying to separate teaching the clinical components from actually getting them to learn how to communicate and work together? So one of the key, I think, aspects for interprofessional education, the way that we teach it in Monash, is that we actually introduced it at quite an early stage of their curriculum. And we always emphasize that what we really want them to be able to do is to be able to communicate and collaborate effectively with each other. And so how we try to actually assess to see if we've achieved those outcomes is to really see how they are communicating, how they are working together, and designing activities that involve team-based work is quite crucial. So we particularly faced a challenge with, I would say, virtual IPE, because at times you may find students tend to go into their own sort of like silos, you could say, and potentially interact less with each other. They would probably just type up things on Google Sheets and not really discuss with each other. So we had to trial a lot of different ways of teaching so that, you know, we found in some methods or aspects, we needed to have a facilitator there to really encourage discussion. In some aspects, when, you know, students got used to working with each other, they were able to do it more effectively self-directed, because then a facilitator would actually make them feel more awkward. So yeah, I think it really depends on what your goal is, but happy to hear thoughts from other panel members as well.
Thank you so much, Anisha, for your answer. If you have further questions, you can type them before we conclude this webinar. Now, all questions.
May I
Yes.
add to that?
Yes, sure.
I think it's very important that we, I'll just say as a background that I'm a registered pharmacist. I'm also a registered nurse. And there's a very different professional culture in nursing and pharmacy. And my educational experience was quite different, going through nursing and pharmacy in the same institution. It's important, I sometimes say, as a nurse, I know why patients are special and do not have guidelines applied to them. Whereas as a pharmacist, I'm always mindful of guidelines, and we always should consider the guideline. That's a generalization, but it speaks to culture, and it's important that students are aware of the differences in culture and the hidden curriculum in professional education.
Thank you so much, Professor Curl. And now, before we conclude, I will give the floor to Professor Abdir Al-Ghananim as well, if you want to add something before we conclude.
Thank you so much. Appreciate it. It was like a wonderful session. There's nothing from my side to add. I think beautiful coverage of topics and very informative session for all of us. Thank you so much. Thanks.
Totally agree. So now, as we arrive to the end of our webinar, I would like to thank once again our speakers for the excellent presentations and for this very informative webinar. Thank you once again, dear all. And also, I would like to thank the FIP team for their excellent assistance. And of course, our dear audience for being present with us today in this webinar. And please do not hesitate if you have further questions or if you want to share your feedback, you can email us at webinar@fip.com. So now I think we can conclude this webinar. If one of our panelists want to add something, you can have 2 minutes. Professor Carl, Professor Martin, Dr. Anisha, Professor Abir, if you want to add something before we conclude, the floor is yours.
No, thank you to you and to the organisers and to everybody at the FIP digital team. And thank you very much to the participants for their questions and comments as we've gone through. And my apologies to Carl for running over time and trying to shut him out of the conversation.
Thank you so much,
Martin.
Professor Martin.
We finished on time, and thank you very much, Hanane, for directing traffic. Thank you.
Thank you so much. Actually, we have one last question. Just now, we can take 2 minutes to answer. It's for Professor Abir. So the question is, do you know how the international accreditation changed the pharmacy education in places other than Jordan? And I see that you are typing the answer. So maybe we will keep. So do you prefer to type it or to
I'll have it answered live. Thank you so much, Dr. Nancy, for such an informative question. Really, I talk about Jordan as a case, but definitely the points of importance and influence of the international accreditation and the pharmacy programs had influenced the schools at a global level who applied for the program and been able to, at least from my perspective, talking about the ACPE, as an international commissioner for the ACPE, I saw a lot of positive impact on the pharmacy education as well as practice for the programs that applied and received the ACPE accreditation, and definitely that apply to a lot of other firms that provide international accreditation. We talk about points and we covered those points, and I talk about Jordan as a specific case, but with all means, those also apply to other schools, whether we talk about the Arab region or in other sides of the world. It has a beautiful impact in assurance of quality in the programs, as well as structuring mainly the assessment cycle and the feedback and to strengthen the programs and moving forward. We can elaborate on this question in more details if you like offline, so I can keep everybody on the same time. But what I talk about in Jordan really apply to a lot of schools, pharmacy at global level, who got the international accreditation. Thank you so much.
Thank you so much, Professor. Thank you so much. So now we can conclude this webinar. Thank you, dear all, once again. And so have a good day, dear all, good evening and good night, depending from where you are connecting with us. Thank you. Bye-bye.
Bye-bye, everybody. Bye.